What can parents identify in children that will tell them कि now they need psychological help? They should go to a psychotherapist.
When a parent is finding that the child is isolated, कि नहीं आता है, बाहर नहीं आता है, कहीं जाने के लिए नहीं जा मतलब सुनता नहीं, कहीं आओ करके बोलने से नहीं आएगा साथ में। फिर बहुत टायर्ड रहता है, हर बार सोया ही रहता है एंड खाना अच्छा सा नहीं खाता है। कोई भी कुछ भी बोलने से एग्रेसिवनेस,
Hmm.
तो इसमें देयर इज़ सम बिहेवियरल चेंजेस इन द चाइल्ड। So when directly if you tell a child चलो जाते हैं seek we go and seek a professional, they won't agree. They won't accept that I have a problem. But parents can try it, like they sit with them, talk to them, they can try it. But it's better taking them to a psychologist, not for a psychiatrist. It's better going to a psychologist, a therapist where they can help them, guide them, and at least for their well-being, just for a mental well-being.
But this can again be related to hormonal changes.
Yeah, this is again hormonal changes.
Persistent sadness is something which is related with hormones, is it?
That is, it comes under the depression area. Sadness.
Okay. Would you like to say कि if somebody is persistently sad,
Huh.
how do you deal with it?
Yeah. You have to sit with them. You should divert them into different areas. Like when you talk to them, as a therapist, when you talk to them, so they will come up with all those things, whatever the content, the words, whatever they speak. So we have to work on those words, whatever they are coming up with. So if it is with the breakup, the thing is they're not missing the person. They're missing the fun related with that person. The situations which goes positive situations, they go, they
Enjoy it.
enjoy and come.
They miss that time frame, the moments they have spent with it. Does the sleep pattern actually
Yes,
relate with depression?
yes. They will have like insomnia, like they no good sleep. Every time you can see them very fatigued, like very tired.
How to deal with worthlessness then?
Same thing, it comes under the.
Basically, you'll have to talk to your child.
Very important is we need to be a companion with the child.
Okay. How can you deal with the suicidal thoughts? When
Yes, suicidal thoughts also comes under the psychological issues of depression, self harm.
Hmm.
All these comes under that.
How do you involve your parents as a caregiver in the therapy? You have to just, but how do you do it?
Sit with them, have a meal, at least one meal in a day. And as I told, like we have to share the routine with them. They will come up with their routines. And in some areas, we have to put some flexible and fixed rules, what I mentioned. Some firm rules and flexible rules. Flexible rules is like your child is going out for a party. So you have to tell the child within 10, you should be back.
Oh,
If you're not back on this day, then next day you just think, after a month only, I'll end up in Coco.
how do you think the screen time has impacted children's mental health?
First to till 12 years, this screen time should be zero.
Zero.
Yes.
But nowadays, if you go to a restaurant, there's this very common see पेरेंट्स खाना खा रहे हैं एक बच्चे के हाथ में एक टैबलेट है एक मोबाइल है he is watching he or she is watching a cartoon and your parents are having their fun time
Yeah.
how uh, but this is very contradictory.
Yeah. But your parents should understand.
Hmm.
Very important role is parents should understand because they engage the child in screen time. But that screen is affecting the child a lot. 4 year, 5 years child. I come into my clients unable to speak the language. The thing is, it is watching those cartoons which has a different language. The child is adapting that language. When it is adapting that language, it's not normal where parents can't understand that language.
मैं आपको एक सिचुएशन देता हूँ ठीक है आप आपकी मदर या आपके बच्चे होंगे तो आपने अपने बच्चों को बिना स्क्रीन टाइम के खिलाया, हमारे पेरेंट्स ने हमें विदाउट स्क्रीन टाइम। बट दिस जनरेशन, आई हैव सीन लॉट ऑफ पेशेंट्स हु कम टू मी, दे कंप्लेन कि सर विदाउट मोबाइल तो ये खाना ही नहीं खाएंगी या खाना ही नहीं खाएगा, या टीवी में जब तक पेपा पिग नहीं चलेगा या डोरेमोन नहीं चलेगा या मोटू पतलू नहीं चलेगा, वो खाना ही नहीं खाए। हाउ डू यू डील विद दिस काइंड ऑफ?
लेकिन उसको स्टार्ट किया कौन?
ठीक है, हो गया।
पेरेंट्स किया।
किया।
हाँ, इसको आओ बढ़ाओ, इसको अभी डाइवर्ट करना है। अभी बच्चा को कोई एक स्टोरी, when I'm talking about these younger children, you have to engage them in some puzzles. If the child is playing with toy, might be blocks. Those children, they play blocks. But as a parent, you have to play blocks with the child. When you're involving the child with you in the same game what child is playing, automatically it diverts from the screen time.
वो तो स्क्रीन टाइम का खाने से इशू मैं, देखिए हम लोग एज अ फिजिशियंस इट्स वेरी इजी टू से ठीक है, आप उसको खाना नहीं खाता है, थोड़ा छोड़ दो, भूख लगेगी खाएगा। बट एज अ मदर दिस इज वेरी वेरी डिफिकल्ट दैट मदर्स कांट सी किड्स बीइंग लेफ्ट हंग्री। तो इन दैट कंडीशन उसको खाना भी खिलाना है और उसको स्क्रीन में भी नहीं एंगेज करना है। उस कंडीशन में व्हाट शुड अ मदर डू?
अभी स्कूल का बच्चे का हम जब बात
नहीं, छोटे बच्चे 1 से 5 साल के बीच।
1 से 5 साल का, जब भी अभी स्कूल से आता है बच्चा जो भी आता, तो वही हम लोगों को डाइवर्ट करना है, बच्चों को टीवी से डाइवर्ट करना है या मोबाइल से डाइवर्ट करना है। तो आप कुछ भी एक ड्राइंग दे रहे हो, तो ड्रॉ करके आप दिखाएँगे बच्चा को, देखो हम आज ये करेंगे। यू हैव टू थिंक सम क्रिएटिविटी।
अगर बच्चा एक जगह नहीं बैठता है, a mother is trying to feed a child and वो इसलिए उसको स्क्रीन टाइम दिखाती देता that kid is sitting at one place and she can feed her,
यस,
him or her. How to make that kid sit at one place?
दैट्स व्हाट शी हैज़ टू थिंक सम क्रिएटिविटी।
क्या?
Something different like, okay, I'm having this food. Um, when हम लोग जब छोटे थे, मम्मी लोग क्या करते थे, ये मेरा है, ये तुम्हारा है, खा लो। मतलब that system we have to bring in. We have to change the entire so that the child will focus on the food.
Rather than on TV
Yeah.
or a mobile.
Yes.
So diversion again here,
Diversion is very important. Yes.
distraction and diversion is the main thing you can do.
Yes.
और पता नहीं मुझे ये कितना सही है या गलत है that if the child is not speaking, you can make them watch something in that language and they can learn। ये क्या सही है?
बच्चा means what age?
मतलब छोटे बच्चे 2 से 3 से 5 साल के बीच के बच्चों, 2 साल के 3 साल के बच्चों, that if they're not speaking, they're not able to speak, make them watch what do you want to।
No.
नहीं, ये गलत है।
आप उसके साथ बात करना है। उसका क्या होता है, अभी बच्चा टीवी देख रहा है, अभी टॉय में खेल रहा है। टॉय डजंट रिएक्ट। जो भी इसका इमोशंस है, जो भी हैप्पीनेस है, सैड है, व्हाटएवर, वो उसके ऊपर थ्रो करता है, व्हाटएवर द फील,
ठीक है।
बट रिएक्शन नहीं होता है। तो इसीलिए जनरली हम बोलते हैं कि बच्चों को टॉयज नहीं देना है। अब देना है तो आप साथ में उसके टॉयज के साथ खेलोगी, तब भी इंटरेक्शन बढ़ेगा, बॉन्डिंग बढ़ेगा।
ओके।
अब अभी बच्चा 5 इयर्स का बच्चा है, वो सिर्फ एक ड्रॉ करता है, तो उसी और एक पेपर लेके हमको भी वही ड्रॉ करना है, तब इंटरेक्शन। मतलब वी हैव टू क्रिएट अ कॉम्पिटिटिवनेस।
Okay. I read some place that not every class buddy is your friend is a phrase used by common psychologists, common therapists. Is that true?
As a student in a class, no one are close friends. All the students, it might be 50 or 55 in a class, all are your friends. All are your friends in the sense, like when you have that friendship with them, you can exchange your books. You'll have a good bond with them. But if you feel that no, she's not my close friend, so there will be a frame like you will be only with those. As a close friend, whatever you have a problem, you will be going only with a close friend.
But then आपके पास ये भी क्वेश्चन आता हो कि ये मेरा क्लोज फ्रेंड नहीं है या मेरा नहीं बन रहा है फ्रेंड, देन व्हाट डू यू एडवाइस?
यस, क्लास में आके वही बच्चे लोग आके जब बोलते हैं कि मेरे पास फ्रेंड्स नहीं, क्लोज फ्रेंड्स नहीं, तो हम यही बोलते हैं कि सभी क्लोज फ्रेंड्स नहीं होता है। एक क्लास में सब जो भी है, सब आपका फ्रेंड्स है। तो आप उन लोगों के साथ बात करो, कम एंड से हाय एंड हेलो टू एवरीबॉडी इन द क्लास।
It is just like कि you are working in an office, everybody can't be your close.
क्ला
They can just be a teammate or a
teammate or a worker because nobody are there with you anytime. Now, start at 7, you're there with them. 8, you're there with them. After 10, they might go to different streams, different schools, different colleges. So here, you cannot say them as a close friend. They won't stay with you for longer years too. So making friends with everyone in the class, it'll be like you can take resources, whatever the resources you need.
okay.
You can take help from them. You can give your help to them.
So what, as a career counselor, what advice do you give to ninthers, tenthers who are just approaching their stage where they have to choose a career?
Yes. In this present generation now standard 8 itself have to choose what they'll be taking in the next class, that is in standard 9. They have optional subjects, like in some schools they have different subjects, so that
We are talking generally, not ICSE, CBSE और जनरल में बात करते हैं कि क्या आप एडवाइस करोगे नाइन्थर को टेंथर को कि वो क्या
उन लोगों को पहले क्या करना है, गोल सेट करना है, मतलब करियर डेस्टिनेशन। देयर आर 3 थिंग्स, करियर डेस्टिनेशन, करियर माइलस्टोन एंड करियर पाथ। So career path is what, when you complete your standard 10, you're selecting the streams. You have 4
That's
streams.
career path.
Yes, you have 4 streams. One is with bio,
Hmm.
and one is PCMC, one is arts, and the other one is commerce. These are the 4 streams what you have. That is career path. The next is career milestone. Career milestone is like you'll be giving some entrance exams. You'll be giving your you'll be having your degrees. All these counts as a milestone, career milestone. If you're going as a commerce, so if you've taken commerce, so you have different milestones, like you'll be going for a BBA, you'll be going for BCom, you'll be BCA. So all these are the degrees, whatever you taken as a, it's a milestone. And the next is, once you have cleared it, your destination is career destination. You'll be reaching your goal.
So what he's saying is कि ninth till 10th course, what they should first focus on
Their career destination.
career destination.
Only then they can work with it. These are the routes, paths.
Okay. So if somebody wants to become a doctor, engineer, XYZ, they need to understand कि वो destination क्या है.
हाँ, route क्या है? We have to be like a driver.
फिजिक्स केमिस्ट्री पढ़ना है तो फिजिक्स केमिस्ट्री के लिए फोकस करना है, आर्ट्स के लिए करना है तो आर्ट्स
हाँ,
के लिए
उसी के लाइन में वो जाना है कि कहाँ से मुझे क्या लेना है। अभी मैंने साइंस पीसीएमसी ले लिया, अभी यहाँ पे लेने के बाद वो लोग सोचेंगे तो पूरा गड़बड़ हो जाएगा। तो पहले वो सोच के वो जाएंगे, तो they will have some route where they can reach. That's why we say we should act as a driver in our life. A driver should know his destination, only that he can reach that place. So we should be a driver as an architect also in our life.
Okay, what advice would you give to anybody who is having an examination pressure? अपने प्रेशर की कल एग्जामिनेशन है या एक महीने बाद एग्जामिनेशन है,
Yeah.
एक्सट्रीम हो जाता है बहुत सारे बच्चों के साथ. So what advice would you give to such kids?
Examination pressure is like they have to segregate the timings, they have to segregate the days, they have to make a routine. Planning is very important in this area.
Okay.
Planning is how, like, they have to make a routine where they will make certain columns, certain days are written, timings are written, and their whole routine will be on that.
मतलब आप कह रहे हो कि from the time they get up to the time they sleep
Yes.
has to be segregated and they have to divide every subject or XYZ and every activity into this. But यहाँ पे एक question आता है जो मैं कह रहा था, procrastination एक word है. Then people
Postpone,
postpone. आप उसको इजी वे में पोस्टपोन होता है कि अभी नहीं थोड़ी देर में करते हैं, ये वाला दूसरे टाइम में करते हैं. इससे how should one
इसीलिए when they're making a routine, they have to make certain columns. They have to segregate the timings for studies. Here, once they are back from school, they need to take some rest, at least 1 hour of sleep. Once they are out from the bed, wherever they're at home, they have to play some indoor games with them.
Okay.
1 hour of indoor games. Because soon after the bed, they won't sit. It's a slow activity where they will not study. So they have to be involved. If you're not involving with them in playing, they will go into gadgets, they will go into your TV, they'll go into different things.
Okay.
But if you're playing with the involving them with you in their games, whatever the games are, puzzles, quizzes, whatever the thing is, then whatever the desires they have it is outbursted now. Now they are ready for the study.
मतलब आप कह रहे हो कि स्कूल से आने के बाद बच्चों को आधे 1 घंटा सोना चाहिए, ठीक है? मेडिकली स्पीकिंग वो सही है बिकॉज़ 45 मिनट्स के जो उनका सेशन होता है स्कूल में, दे आर लाइक ड्रेन्ड आउट।
Yeah.
तो आने के बाद सोने का और सोने के बाद 1 घंटा रेस्ट करके गेम्स-वेम्स खेल के या कुछ भी, देन दे शुड सिट फॉर स्टडीज़।
They have to make a routine. At least depends if standard 9, they will be sitting for 3 hours.
Okay, 3 hours of study.
3 hours of studying. That has to be there in a day. I'll be talking on 4 P's now. First one is place. They'll be sitting in the same place, like table and chair, not on the bed.
Okay,
Because what happens, our body has a memory. So when you're sitting on the bed and if you're reading, our body is like saying that the bed is to take rest. So it cannot focus. Our mind cannot focus on that. So they have to take a table and chair. If there is no table and chair, they can sit on the floor,
okay,
not on the bed. So they can do this. That is place. And that place, it'll be a secret for them. Like they should see that this is my safe place because I do my studies here. I respect that place. So once they start with that place, sitting in that place, that should be their place.
ठीक है।
Second, and on the same time.
मतलब एवरी टाइम उनको उसी टाइम पे बैठना है। मतलब शाम को 6 बजे बैठना है, तो वहीं पे बैठना है।
रोज स्टैंडर्ड 9 के लिए 3 आवर्स, वो स्टैंडर्ड 10 के लिए 4 आवर्स कर सकते हैं, मतलब वो लोग सेग्रीगेट कर सकते हैं 2 to 2 आवर्स। तो ये 3 आवर्स में वो जो प्लेस है, वो प्लेस एंड द सेकेंड प्लेस पॉस्चर,
ओके,
we need to maintain the posture. Study posture is very important. And the third point is, I generally said for 6 to 10 years of those children, like standard 5, 4 and all, they should play that play teacher. We used to play teacher when we were in the younger classes. So now they can take a topic and they can play for themselves. In standard 9, 10 and all, they can take a topic and because their tone, their voice, their pitch, their mind will absorb it. And fourth point is proactive. Proactive is planning. How planning is, in a day, they can take 2 subjects. So table should be very tidy. Nothing on the table. If you're studying your English copy, English text and dictionary, nothing should be there on the table. Dictionary and the rough copy where they can note down the points. Before going to bed, they have to revise those points. It's better to stick that routine on the wall so that it motivates them.
ठीक है। I'll give you a scenario where ठीक a child gets up at 6:30 in the morning, reaches school by 7:30, come backs by 2:30, has his lunch, 3:30 it's over. So 4:30 sleeps and gets up. 5 then nowadays I think there is nobody who doesn't go to tuition.
Yes.
एक भी नहीं तो 2 तो कम से कम होते ही होते हैं। So at time it is like 8:39 kids आते हैं घर आए आपने। What after that you are advising कि वो आने के बाद खाने के बाद उनको फिर 2 घंटा बैठना चाहिए, 3 घंटे बैठना चाहिए पढ़ाई के लिए?
Yeah, that self-study should be there. But they have to consume the time. For tuitions, what they do? Generally, tuitions, what has to be done is, when they are doing their studies at home, any doubt, they'll note down and that has to be clarified with the tuitions.
पर जनरली आजकल मैंने जो जितना लोगों को देखा है
More time in
इन ट्यूशन
yeah.
एंड टीचर्स का ये कंसेप्ट होता है कि मैंने तुम्हें ट्यूशन में पढ़ा दिया है, नाउ यू जस्ट नीड टू गो एंड रिवाइज फॉर 15-20 मिनट्स। तो उनके दिमाग में ये रहता है कि अपने ट्यूशन तो पढ़ लिया, ट्यूशन पढ़ लिया एंड आई हैव डन माय पार्ट ऑफ माय जैसे मेरे को ये 1 घंटा मैथ्स पढ़ना था या फिज़िक्स पढ़ना था या अकाउंट्स पढ़ना था, तो 1 घंटा मैंने अकाउंट्स पढ़ लिया दैट इज़ मोर देन एनफ। तो व्हाट एडवाइस वुड यू गिव कितने दिन they should sit and study again after 9 o'clock after their dinner?
Here they have to sit. They have to sit at least half an hour, at least 1 hour. They have to sit for self study. Self study is very important. So that what happens, they focus on that. Because studying in the school, what happens is children are like distracted with so many things. They won't focus on that. Nowadays in tuitions also they won't focus because there are too many children in a tuition, not 4 and 5, more than that. So they just say that I'm going for tuitions, but
नहीं होता।
नहीं होता है। तो वो ये जो सेल्फ स्टडी है वहाँ पे थोड़ा सा टाइम कंज्यूम करके सेल्फ स्टडी एटलीस्ट हाफ एन आवर 1 hour they have to give.
So this is you're talking about uh, 7th 8th स्टैंडर्ड के बच्चों के लिए, बट 9th 10th 11th के लिए देते लाइक
सबको
3 hours कंपल्सरी होना चाहिए।
हाँ, वो करना चाहिए, वो लोग को कंज्यूम करके करना, सेल्फ स्टडी करना है। वीकली वन्स, वीकली वन्स उनको क्वेश्चन पेपर प्रिपेयर करना है।
सेल्फ
मतलब जो हुआ है, 1 वीक में जो हुआ है, बहुत कम सिलेबस रहता है, तो उसका क्वेश्चन पेपर प्रिपेयर करने से वो कैसे प्रिपेयर करना है, जो पैटर्न जो आता है, स्कूल में जो पैटर्न में आता है, सेम पैटर्न वो स्कूल में मिल जाता है। तो ले जाके प्रीवियस ईयर का, ले जाके वो पैटर्न ज़ेरॉक्स करके देन they have to make questions as it is in the pattern, school pattern.
हाँ।
करने से क्या होगा, द चाइल्ड इज एट होम, घर पे वो मतलब वो ऐसा ही उन लोग को प्रिंट आउट निकाल के दे रहा है।
ओके।
तब
तब यू
बच्चा
लाइक
कुछ
से कि वो सेल्फ एग्जामिनेशन करना है।
हाँ, जनरली आई गेट दिस थिंग लाइक घर में अच्छा पढ़ता है मैम, सब करता है मैम, लेकिन एग्जाम में नहीं लिख रहा है, मार्क्स नहीं आ रहा है। Many parents come like this. So I guide them in this way. You have to make a question paper for your child. I guide them from KG onwards, KG till plus 2.
So this is how one should deal with examination pressure.
Yes. So once they are at home, they are in a cool atmosphere. They will read the question, understand the question, then they'll write the answer. But if they come in the school, like there's so many questions, so many things that
अच्छा,
they
वो
can,
they get scared. They get scared with the questions.
this is like they can come out of the examination.
Peer pressure.
Yeah, it will be easy for them.
Communication is the key to every relationship, no matter it is husband wife, it is student or parent, father or son. With this, I come to an end. I hope you enjoyed my podcast and you give me a feedback where I can improve myself more. Let me know what better can I do to reach up to you and come up to your expectations. Do like, share, subscribe to my podcast if you've got something out of it. Thank you.